Good morning, one and all, and thank you for this opportunity, Ashay, Vijay, and the entire team. This is very discussed topic, and everybody is shifting the gears to neoadjuvant chemo and immunotherapy. So I'll be presenting this Nadeem 2 trial, Nivo plus chemo versus chemo in the neoadjuvant therapy, especially in a subgroup resectable stage 3 cancers, NSCLC, and the primary endpoint PATSIA, that is what I'm going to discuss. So we all know that NSCLC is the majority in the lung cancer. 1/5 do present in stage 3. Multimodality is most of the time required. But in spite of doing everything, the outcomes are not very impressive. We have a 5-year overall survival less than 40%. Preoperative chemotherapy has enhanced this 5-year survival by, but it not much, but just 5%. And there is gaining evidence that if patients are achieving PATSIAs with NACT, or combination, slowly the trend is becoming better, and the PATSIA are still achieved only by neoadjuvant chemotherapy at just 4%. So we want to increase this PATSIA indirectly. That's what is the idea all about. So there comes this phase 2 trial, single arm, where they have probably inspired by the Checkmate 816, and they want to do something beyond Checkmate 816. They have combined chemotherapy and Nivolumab in the neoadjuvant therapy versus neoadjuvant therapy in stage 2 and stage 3A and B. So this was a very simple study design. Patients who are locally advanced, stage 3A and 3B, who were EGFR and ALK excluded, which is very important because now you have to start doing even in non-metastatic patient the molecular markers before you take up for these patients on a combination therapy. Nivolumab at 360 milligram every 3 weekly with Pacli and Carbo, standard dose 205 AUC5 versus the control arm, which is the standard arm. After 3 cycles, patients were taken for surgery, expecting an R0 resection, followed by adjuvant Nivolumab of 480 milligram once a month or 4 weekly dose for 6 months. So this is something beyond Checkmate 816. And the control arm obviously followed just observation. So the primary endpoint was the PATSIA in the intention to treat population, where a multiple secondary endpoint, especially what I'm going to discuss is the MPRs, the safety, and the overall response rate. So statistical analysis was done, and it was found that sample size 90 would be enough, 60 in the experimental arm and 30 in the control arm for randomization of 2:1. So 90 patients were recruited, 4 were excluded because they did not meet the eligibility criteria. Most of them underwent surgery on the experimental arm. Few did not went under surgery in the control arm. I'll come to that later in the next slides. Baseline characteristics were almost well matched. There were some differences, but not very significant. Same with the comorbidity. In fact, there were the comorbidities were a little more in the experimental arm. So coming to the surgery summary, we can see that in the experimental arm, when you combine Nivo and chemo, you can almost operate everybody. 93%, but in chemo you could operate only 70%. And the caveat there, you can see that there was few patients who have actually progressed. So there were 4 patients who did progress on therapy, and that's what we do not want in patient who is resectable, right? So we have to, this is the primary endpoint, the PATSIA, and we can see there is a stark difference of almost 30% between the experimental and the standard arm, 7 versus 37%. Coming to the secondary endpoint, the MPR, this is the minimum thing what we expect when we use this combination. And again, there is almost a 40% difference, 13 versus 53 months, 53%. So that is almost a 40% improvement in the MPRs. Coming to the overall response rate, again, it is showing an improvement of around 48% versus 75%. And obviously, when you combine an extra agent, especially with a little different kind of action, we do have a little more side effects in grade 3 and grade 4. So we can see that diarrhea was a little more, fatigue was more. There were febrile neutropenia. I don't know how, but febrile neutropenia was also a little higher. And we know this, how to tackle this, how to monitor this, and how to treat it. So that is not something which has raised alarm or have new flags, new red flags. So concluding, according to the PATSIA, we see that Nadeem 2 has shown a positive trial. It has improved the PATSIA, as we can understand, almost by 30%. and it has maintained the safety profile. There were no new safety problems which were encountered. Obviously, there were little increased grade 3 and grade 4 toxicity. And the most important, it did not impede the feasibility of surgery. At our center itself, we have done many patients who have undergone immunotherapy plus chemotherapy combination as a neoadjuvant setting, and surgery was little difficult, but it is not impossible. Like we have shared across the globe, we have asked people who are doing such surgeries, and they all have little difficulty, but it's not impossible. So it's definitely doable. So thank you for the attention, and that's my team from Tangam.